and mental and also social. And so if one is not, we all have you can have TB, you can have malaria, and out there it's very normal to have malaria, but then when you say you have a mental illness, it's an issue. And so there's a lot of stigma because it's still a taboo, and this is why we need to educate people right from the ground level, going to the grassroots in communities, in villages, in schools, in universities. We need to do a lot of awareness and education. Yeah.
Guys, this is May. It's a month about mental health. We are talking about mental health, but the youth are actually funny. She will tell you that mental health illnesses are for the rich. Me who doesn't have money, how do I even start suffering from mental health illnesses? And then that's also some kind of stigma that I don't know, some bias. And you find out that someone actually has that illness because poverty is one of them, right? Now I want you to talk to me.
Well, there's so many causes to leading somebody to mental illness. It varies. Anything can cause a mental illness. It could be loss. It could be sickness. It could be an accident. It could be anything.
Even poverty.
You're so much into poverty. Yes, poverty is, but I want to. I don't know, but it's something that we have to really, really think about. Yes, because I think we have defined poverty according to maybe the Western world, but like in Africa, if you have cattle, you have your food, you have your farm. I don't count that as poverty. And so you'll find in our local villages, you'll find somebody with a whole farm. You'll find somebody with a cow, and they're comfortable. And personally, I don't count that as poverty. Okay. They are rich in their area. Yes. And so I wouldn't want to say poverty, though, of course, when we look at what the World Health, what research tells us, and they say poverty is one of the causes to mental illness. But then I look at it at a different level. Yes, so anything can cause a mental illness, and we don't have to judge because we were created differently, right?
Yeah.
Yeah. So how you handle issues is not the same way how I handle. I went through loss, and I had to deal with grief throughout my life, like my younger age, teenage, my adolescence stages until I grew up into a woman, and I dealt with grief. And I remember, I would tell certain people around me, I'd be like, how do you deal with grief? You're still grieving about somebody that passed away so many years ago. Yes, and I'm like, no, we're created differently. Somebody can lose something today or somebody today, and next week they're fine, and
they're okay.
They're okay. Yes, and then somebody will go through the same experience, and it will take them 20, 10, 30 years for them to get over it. So we don't have to judge people. We have to let people be and let them go through that journey, because it's also important. Yes.
Now to the youth, because we're actually focusing on the youth. If I'm going through the same situation,
yeah,
and therapists are actually expensive.
Yes.
Even finding someone that this is a therapist and they're going to work on you is hard. If you can help us with the process, at least I personally can go through to prepare myself to heal. As a person, because yes, I know talking to someone else would be more better, but as a person, what if I want to heal on my own? As you said, it's hard to talk to people that I have this issue and they understand. For me, healing on my own,
I don't think I wouldn't advise you to do that. Okay. We were raised in communities. I remember a child is that saying that says, you see how African culture, we raise children communally. I believe in community. personally, I believe in community, and I know that you can't go through a situation by yourself.
Yeah.
Because mental illnesses make you lose hope. Yes. So when you're depressed, you end up, being hopeless. You don't have hope for the future. You don't have hope to life. And so you need somebody that is going to walk you through that journey to regain back your hope. So I wouldn't advise anyone to do it alone. I tried it and it was really, really hard.
It's really hard.
Really hard. Because there are certain moments where you just need somebody to give you hope, talk to you, to tell you that you can do it, you can keep pushing. Yes, and we have to be very critical in looking for these people. At least look for somebody that you can trust. You don't have to tell everyone your issues, Yes, you just need that one person or two people that believe in you and see the potential that you have, and they're able to walk you through that journey. So no one should go silent about it.
Okay.
Yes, I know therapy is expensive, but also I know Ministry of Health is trying to work on a few issues, a few things to make it less. Yeah, so you don't have to. You can start with looking for a friend, a family member. It can be anyone, a mentor that can talk you through your situation.
Rebecca.
Yes.
This thing of talking to friends.
Yeah.
And the mentors.
Mm-hmm.
One of the things that people don't talk is because we fear judgment.
Yes, and that is where the stigma and discrimination is. But then I think this is why we now need the education bit of it.
Okay.
We need to educate people that, and do a lot of awareness actually. And tell people that, and let people know what exactly mental, because if you don't know what mental health is, you're going to judge somebody.
Of course.
Yes, and then we live in a very unkind world. Like everyone is so angry and rude. Young people are angry. They don't have jobs. You move out here right now, and the roads are bad. So you're filled with all this anger, and then that's why it's right now we young people have taken all this anger to social media, and so somebody writes and says, "Guys, I feel low," and everyone's like, "You can die. We'll move on." All those comments. Yes, I keep seeing them on social media, Twitter. I'm like, no, we've become so unkind and so angry at everything because of the things that we're going through, but we're not created to be that. Yeah. So you don't really have to tell all your friends. None of my friends knew that I was dealing with a mental illness.
Okay.
Yes. Through the entire journey where, I was taking medication and going for therapy, no one knew. None of my friends. But then I had to look for somebody out of my circle who saw a lot of potential in me, and they helped me navigate through that journey. So it doesn't have to, it can be a family member that you trust. It can be anyone. Yeah, but somebody that you trust.
Talking about trust.
Yeah.
So some friend of mine told me that, if you don't trust any of your friends or family, you should wake up in the morning, walk into a mall, tap on someone, tell them, hey, can I talk to you for a minute?
Yeah.
And sit them down, tell them your story.
Yeah.
But my question is, so if I land on someone...
Now that's the problem. Someone that is not in the mood to listen to your stories. But
this person will come and tell me, you're actually going crazy.
Yeah, but it starts with, I think, now we're having the conversation. So I don't expect you, Daisy, to be rude to somebody out there.
Okay.
Yeah, so I expect you to be kind, because, these conversations are here to create awareness and educate the public about all these issues. And so the fact that we're having the conversation and so many people are going to listen to this podcast is already a platform to educate.
True.
And so because of, us sharing our experiences, just be kind. If somebody walks to you, just even if you have your world is going crazy, just be kind.
Guys, be kind.
Yeah.
I am also kind to some extent. No, but I understand, because sometimes it's hard to find someone who is this kind. Then you will find out that people actually want to use you for your kindness. Like you tell them, yes, I will always listen to everything you're saying, and then before you know it, they want to use that in an advantage. But as Rebecca said, you can learn. You need to learn what are the signs and symptoms of someone who has a mental illness. Always give them an ear. Maybe they might not be using you, they might be going through something big. So if I may ask this question, what are some of the common mental health issues that young Africans face, and what can they do to cope with them?
Africa has the youngest population globally. We're about 65% of young people in this country. In this continent.
Yeah.
And even in Uganda, actually, we make up 70% of the population.
We're many.
We're 48 million, almost 50 million. And 70% of that is young. So I think our parents are really doing great in
doing great.
But yes, there's so many issues that young people face. We have poverty, we have unemployment, inadequate education, which is really, really a big deal. There's also technology, which is good, but also not so good. There's a negative bit of that. It also affects our mental health. And then we have relationship issues, we have trauma from the wars that we've had, the family dysfunctions and all that. And then we have child abuse. Yes, so the youth really face so many issues. And then all these issues, bring later cause trauma, they cause mental illnesses like depression, anxiety, bipolar. And so research, of course, has shown that people in Africa, young people in Africa, the 65%, are mainly affected by anxiety and depression. And so anxiety disorders makes up 29.8%, and depression actually is at 26.9%. And so those are the main two main illnesses that young people face.
Okay.
Yes, and then also it's sad that we don't have access to the services, because when you look at, for example, Uganda, Butabika accommodates just a few number of people, but then if the current Ministry of Health recently told us that 14 million people are sick in this country. Yes,
I heard
so if you have 14 million sick Ugandans and one mental health hospital that is not even going to accommodate 1,000 people, really.
And of which these 14 million talk to people.
Exactly. And it could be me, it could be you.
I know.
Yeah, so we don't have access to the services for all this. Yes, Butabika is there. I don't know why people get scared of Butabika Hospital. But also that's because of the stigma that we've created. Every time I say I was once in Butabika, everyone's like, you don't look like so. And I'm like, why? I mean, it's a mental health hospital, just like you have Mulago Hospital. And it's, yes.
That if you're in Butabika, you're going crazy. You were beating people.
Yes. So it's sad that research also tells us that 50% of the mental disorders have their onset before the age of 14. I think that is because of the child abuse and all the things that we go through. And so 70% of us actually get a mental health issue before the age of 14, and 75% before 25. So it's really sad, like you see the gaps, and then it's now up to us to find the solutions to those gaps. So yeah, we really go through a lot. And now there's Generation Z, and it's a crazy generation coming up. Very different, yes.
I feel like relating to the other generation is you're becoming backward.
Exactly.
And then these other people really understand what we're going through. They've been there.
Yes. And so you find young people so pressured. Like you find a young person, they want to achieve things so fast.
Yes,
they want to
at 24.
At 20. Yes, exactly. And like you have to work for it. You have to, be patient. But then because we have technology now, like young people have access to social media and all that, and so you keep seeing somebody doing so well, you don't know their journey, and now you start being envious and you want to be like them, and so you start being depressed because you feel like the world is crumbling down at you, yet it's just a mindset.
Most so social media.
Yes.
Social media has a lot of lies.
Yes, everyone
and you
wants
can
to
get traumatized because of social media photos and whatever.
Exactly. And maybe to just advise young people, take social media breaks and don't believe everything that is there. We're just there, showing the best of our lives. No one ever shows their sad life out. Yeah.
It's a few.
Yes, a few. Like myself, when I'm depressed, I'm into post and I'm like, man, I'm dying.
Then we also fear the posts that people are saying, I'm depressed, I'm not okay. I feel like that post would depress someone.
Yes. It would also do that. But then also, I think there's need to, like, can you sit and analyze? Like, I've seen people post on Twitter and they're like, I'm going to, kill myself. Yes, and then like I've taken, like, sometimes I'm like, let me inbox this person and see what they'll say. And you actually realize that this person is serious and they need help. Okay. Yes, like I've had those situations where even somebody comes to my inbox on social media and they tell me something and I'm like, I think this person. So what I normally do is, because like sometimes it gets too much into, your brains. You're thinking of how do I help this person? But then at that point, I think that's when you refer somebody to like a therapist or a counselor, and then they start their journey from there. Yeah, so let's not ignore those things. Yeah.
But do you actually know that there are some youth that actually don't know that actually have mental illness?
A lot of us.
There's a friend of mine who told me, if I have money, my friend, mental health to you too. I'm like, what? Yes, if I have money, mental health, no. And before you know it, she was crying about someone, the boyfriend leaving her. I'm like, so what?
Yeah, that's why I said anything can cause a mental illness. You could be it, like, when I get all this money, I'm going to, be okay and all that. I also used to have the same perception, really. But it's not that. It's anything can break you down. Anything. Yeah.
Oh wow. So I think I asked this question, but I think I need clarity about it. How can friends and family members of individuals with mental health issues offer support, and what can they do to help break this stigma that's actually too much?
So I think the best thing is we start at a family level. Us that are now educated, our grandparents didn't know these things.
Yeah.
Yes, but I think a family is at the smallest unit of a society.
Yeah.
And so if we are to change something, we have to go deep down into our families. Let's start having mental health conversations in homes. Like, let parents start talking to their kids. Let's normalize it.
Okay.
Yeah.
Yes.
Yes, it's very important. Let's normalize it from home. How you treat your children, how you treat people at home is very, very important. Let's be loving, caring, and let's build trust at family level.
Yes.
Where if I have an issue, I'm able to talk to my brother, I'm able to talk to my sister, I'm able to talk to my mom, my dad. Yes, let's start at a family level, because even if we make the policies, we speak so much about stigma, and yet deep down at the family level, it's not working. Then I don't think we're going to succeed. Yes, and then let's help your loved one to find a trusted mental health care provider. Yes, that's like, if you notice that your close one is not well, for me, really, the best thing you can do is find a professional. Yes, because they know the mind. They have studied these things. It's like, if I have malaria and I don't go and see a doctor, or if I have cancer or TB and I don't see a doctor, then really, who is going to prescribe the medicine? Who is going to talk to me? So I know we shun a lot from looking at the medical bit of it. We are so much into the spiritual bit of it, which is okay. Yes, but also let's normalize looking for a psychiatrist or a counselor, a therapist. And you don't need to actually have a mental illness to see a therapist, because life throws so much at us every day. I mean, your boss will be angry at you today, and you feel like, oh, I want to quit. I want to, I'm tired. So anything it's life, and that's how life is should be.
Yes.
But then you have to look for somebody to always talk to, somebody you can refer to. You're like, today I feel such and such a way, and so I need help, and that person is there. So let's normalize looking for mental health professionals. It's very okay. And then let's be kind and judge and not be judgmental. Yes, and just give them the support they need. It could be you tomorrow. It could be your child. It could be somebody close to you. So you just have to be kind and not judge. Just because you're able to navigate through a certain thing and somebody is not, you start judging them. No, give support.
Wow, thank you so much. I think my last but not the least, what advice do you have for young people who may be hesitant to seek for help when they have these issues?
Oh, well, so young people, fellow young people, I'm also young. Don't be afraid to ask for help when you know you need it. Asking for help is not a sign of weakness. It's a sign of strength and courage. And I personally believe in vulnerability. Like, if you're close to me and you're not able to be vulnerable to me in your most weakest moments, then I don't consider that a relationship or a friendship. Yeah. And so let's not be afraid to seek out for help. Seeking out for help is courage in itself, because you're trusting somebody, and that takes a lot of courage and strength to actually speak out. But then there's power in that, because you gain hope. Yes.
You gain strength. You wake up in the morning and feel like, yes, I can do it once again.
Yeah, that is it.
Yeah.
Yes.
So how can we increase our awareness about mental health issues and reduce the stigma around it? Surrounding our youth.
So I think we need to openly discuss about mental health, like what we're doing right now. I'm so excited. Openly discuss, and I've actually noticed that there's been a whole big trend. So many people have been talking about mental health, and I think this came with the pandemic. Before the COVID-19 pandemic, like I used to be so vocal about mental health, and everyone would be like, no, like what's that? But then after the pandemic gave us, I think it opened our eyes to actually see that these things are real and that they affect us, because the pandemic came with restrictions like staying at home, and so you can't see your loved ones, you can't go out to the bar.
Then we got depressed.
Yeah, you can't go to church, you can't see people. So you're home and you're in this space you've never been in like that your entire life, and so you start being depressed. So many people went through loss. People lost their loved ones, and they were not able to bury them, and so you go through grief silently. You're not able to see anyone. Where there was a lot happening, and I think after that people realized that anyone can actually have these issues. Yes, and so I've seen a lot of conversations about mental health, and I'm really excited that we're taking that initiative to talk about it. But also, I think what I would advise more is us really getting deeper into it and understanding, because there's also a lot of misinformation. Sometimes I log into Twitter spaces, mental health Twitter spaces, and I see somebody talking about mental health, and I'm like, no, that's not mental health, So let's really understand. Let's get the right information and create all these conversations. That's very important. And then let's use our voices as youth. to advocate for better mental health in our country, looking at the services, looking at community. So we have the institutional bit where we have government and funders. Let's look at the funding. The health budget in Uganda is just about 9% of the total budget. So the Ministry of Health gets around 9% of that, and about 1%, less than 1%, goes to the mental health department.
Okay.
Yes, and so if you have all these youth that are not okay and they need awareness, they need the services, it doesn't make sense. And so we need more investment in mental health. And so that's at the institutional level, the policies, the funding. Yes, and then we have the community level where we have the stigma now.
That's true.
Yes, there's a lot of stigma in our communities, a lot of discrimination for people who have mental illnesses. And then now we have the individual, where you have the self-stigma. So all those, we need to come up as youth and advocate. If you're advocating for better policies, what do we need to do? If you're advocating for funding, if we're going to, break the stigma, what do we need to do? Have the conversations, educate people. Yes. Lastly, I think mental health, first of all, is an integral part we should make mental health an integral part in the different programs, different community programs. And so if I go to my district, Kapshara district, and I'm talking about sexual reproductive health, I need to bring in mental health, because for example, when you look at a girl going through menstruation, they're definitely going to be stressed. Yeah. It's quite an interesting experience for us. So we need to bring in mental health, because even when you look at climate change, there's no way you can pull out mental health, because they're all intertwined. And so mental health is at a bigger picture, because it's all in the mind. Yes, and we're created, everything is in our brains, up here. Without up here, the brains, you're not going to live. Yeah, so we need to make mental health an integral part of all the programs that we're doing at organizational level, at government level. If it's schools, we need to start teaching young kids about mental health.
True.
As one of the subjects. Yeah. We're teaching them a lot of reproductive health and sexual reproductive health, but then we're forgetting something that is very important and something that is going to shape them into becoming better citizens.
True.
Yes.
Yes. What policy should the institutions put up? Like, I feel you talked about government policy or institutional policy. What specific policy do you think they should put up to support mental health?
There are so many things. Actually, there are so many things. But I think for now, sitting from, the lived experience table and passion, we need to decriminalize suicide as a country. Kenya is already doing it. And I'm glad that I had the opportunity to actually be at the center of that document in Kenya. So I had the opportunity to read through it and understand, and I feel like it's really important, because if you do that, you're going to have more people opening up. You're going to have people seeking out for services. Yes, so we really need to. Those are some of the things that we need to advocate for. Yeah.
Oh, wow. Thank you so much, Rebecca, for joining us today and sharing your insights on mental health.
Thank you, Daisy.
We hope that our listeners actually so much, because I feel like this conversation has been the most important conversations I've had. So we hope that you find our discussion informative and helpful. Remember, mental health is just as important as physical health. You guys, you stop focusing more on physical and you forget about your mental health. Before you know it, you're going to lose it. Yes, and one more thing you have to say?
Yeah, I just wanted, like when you're saying that, I remembered something. And I think for too long our systems have failed to understand the significance of mental health. And for too long we think about healthcare, we act as though the body just starts from the neck down. And then we forget the brain, we forget the mind. And so instead of understanding, we also need to address healthcare from the neck up, the mental health. Yes, so let's address healthcare as physical and mental, not just physical the way we do it. Even, when you look at the primary healthcare services, let's integrate mental health into part of it. Where, for example, if you go to hospital and you have malaria or you have anything, when like how you go to hospital and they tell you, take your weight, do this before you see the main doctor. We need to have mental health as part of that, where you're able to sit with somebody and like, what are you going through, just to understand, because certain physical illnesses actually come from the mental health bit of it.
True.
Yes, so just for somebody listening and they're struggling with a mental illness, please know that you're not alone, and that you are seen and valuable, and that you deserve to receive the help that you desire and the help that you need. So reach out to somebody and tell them about what you're going through. Yes, and to the public, let's be kind.
Please be kind.
Yeah.
Thank you so much, Rebecca.
Thank you to Daisy.
Seeking for help is not a weakness, as Rebecca said. Yeah. It's actually a strength. So I think it's important for you to seek for help. Guys, let's work together to break the stigma surrounding mental health in Africa and support each other on our journey towards mental health. But of course, it is the Afro Youth Connect, where we talk about African issues. What is it that is affecting Africa? And of course, we are on our MCI Radio podcast app. For you who have you can actually download the app, and that is our theme colors are blue, orange, and white, MCI Radio podcast app. But we also are on Spotify. Thank you so much. My name is Daisy Kavura, and of course, I was with Rebecca today. Thank you for joining us. Till next time.
Thank you. Bye.